7 medical checkups you should skip after 60. They can harm your health. As we age, regular checkups become an essential part of maintaining our health, but not every medical test is as harmless or as helpful as it may seem. In fact, for seniors over 60, some common screenings and procedures can do more harm than good, exposing you to unnecessary risks, false alarms, painful side effects, and even dangerous interventions that you might never have needed in the first place. The medical world often works under the principle of better safe than sorry. But when it comes to older adults, this approach can backfire. Imagine going in for a routine scan, only to end up with invasive surgeries, new prescriptions, or months of anxiety over something that would have never caused you trouble. This isn't fear-mongering. It's a reality backed by research, patient stories, and even doctors who now admit some of these tests may be outdated, overused, or downright risky for seniors. Today, we're going to walk you through 7 medical checkups you should seriously consider. Skipping after the age of 60, counting down from number 6 to the most potentially harmful one at number 1. Each will come with the science, real life examples, and most importantly, safer alternatives so you can make informed choices about your health and avoid unnecessary danger. Number 7. Full-body CT scans for early detection. Full-body CT scans are often marketed as the ultimate peace-of-mind tool, offering a supposedly comprehensive look at everything happening inside your body. Clinics promote them as a way to catch disease early, and some even package them as wellness gifts for seniors. But here's the truth. For most people over 60 with no specific symptoms, these scans can be far more harmful than helpful. First, the radiation exposure is significant. A single full-body CT can deliver up to 1,200 times the radiation of a standard chest X-ray. That's not a small dose, and repeated exposure increases your lifetime cancer risk. Second, these scans are notorious for producing false positives, spotting harmless anomalies that trigger a chain reaction of unnecessary tests, biopsies, and sometimes even surgeries. Many seniors have gone through months of stress, invasive procedures, and even long hospital stays, all because of something a doctor later called clinically insignificant. And let's not forget the cost. Insurers rarely cover full-body CTs done without a clear medical need, leaving seniors with bills in the thousands. Better tip: if you have no symptoms and your doctor hasn't identified a specific concern, skip the full-body CT. Instead, focus on symptom-driven testing and proven, age-appropriate screenings like bone density scans or targeted ultrasounds. These offer more benefit with far less risk. Number 6. Routine PSA blood tests for prostate cancer in older men. For decades, PSA prostate-specific antigen blood tests were considered an essential part of men's checkups after 50. The idea was simple: catch prostate cancer early and save lives. But research over the last 15 years has revealed a more complicated truth. Especially for men over 60, PSA levels can rise for many harmless reasons: benign prostate enlargement, minor infections, even recent physical activity, yet a high reading often triggers aggressive follow-up, biopsies, repeat tests, and sometimes immediate treatment. The problem: most prostate cancers found in older men grow so slowly they would never cause symptoms or shorten life. Treating them unnecessarily can bring life-altering side effects: urinary incontinence, erectile dysfunction, chronic pelvic pain, and increased infection risk. A study in the New England Journal of Medicine found that widespread PSA testing led to massive overdiagnosis, meaning thousands of men endured treatments they didn't need. In seniors, the risks of surgery or radiation often outweigh the benefits, especially when other health conditions are present. Better tip: if you're over 60 and symptom-free, discuss the pros and cons of PSA testing with your doctor instead of adding it automatically to your checkup list. For many men, Watchful waiting and lifestyle monitoring provide safer, lower stress outcomes than chasing every fluctuation in a blood test. Number 5. Annual ECGs electrocardiograms for healthy seniors. An ECG is a quick, painless test that records the electrical activity of your heart. And it's life-saving when you have symptoms like chest pain, shortness of breath, or irregular heartbeat. But for healthy seniors with no heart-related symptoms, doing this test every year just in case can cause more harm than good. Here's why. ECGs can pick up harmless irregularities that naturally appear with age, tiny changes in heart rhythm that aren't dangerous but look suspicious on paper. Once flagged, these can set off a chain of follow-up tests like stress echocardiograms, cardiac catheterizations, or CT angiograms. Each of these carries its own risks, from radiation exposure to allergic reactions to contrast dye, not to mention the anxiety of believing you have a heart problem when you don't. Research published in JAMA Internal Medicine found that routine ECGs in low-risk patients lead to a significant increase in unnecessary invasive procedures without improving outcomes. For seniors, that can mean weeks of worry, added medical bills, and physical stress from interventions that weren't needed in the first place. Better tip: skip the annual ECG unless you have new or changing symptoms, a family history of early heart disease, or your doctor sees a clear reason. Instead, prioritize blood pressure monitoring, cholesterol checks, and daily activity. These are proven to keep your heart healthier with less risk. Number 4. Routine colonoscopies after age 75. Colonoscopies are one of the most effective tools for preventing colorectal cancer. And for adults in their 50s and 60s, they can be life-saving. But after age 75, the equation changes especially. If you've had clean results in the past, the procedure itself carries risks that increase with age: sedation complications, intestinal perforation, internal bleeding, and dangerous infections. Recovery can also be harder on older bodies, leading to dehydration, electrolyte imbalances, or falls from the laxative prep. A large study in Annals of Internal Medicine found that the risk of harm from colonoscopies rises sharply in seniors over 75, while the potential benefit drops, particularly for those with no symptoms and a history of clear screenings. What's more, even if a small growth is found, it may be so slow-growing that it wouldn't impact your health in your remaining years, yet removing it could still bring serious complications. Better tip: if you're over 75 and have had regular, normal colonoscopies, talk to your doctor about stopping routine screenings and switching to less invasive options like FIT fecal immunochemical tests or stool DNA tests. These can catch warning signs without the same risks or recovery burden. Number 3. Bone density scans DEXA too frequently. Bone density scans, known as DEXA scans, are one of the key tools for diagnosing osteoporosis and monitoring bone health, especially in women after menopause and in men over 70. For seniors, it's easy to believe that the more often, the better. But in reality, doing these scans too frequently can create unnecessary fear, medical interventions, and even harm. Here's why. Bone density naturally declines with age, but the rate of change is usually slow, often less than 1% per year in healthy individuals. This means that small differences between one scan and the next may be nothing more than normal variation or even machine error. Yet those slight dips in numbers can trigger a cascade of follow-up actions: repeat scans, expensive specialist visits, and prescriptions for powerful osteoporosis drugs. Medications like bisphosphonates, for example, can cause serious side effects, from chronic heartburn and esophageal damage to rare but devastating complications like osteonecrosis of the jaw or atypical femur fractures. Once started on these drugs, some seniors end up taking them for years without a clear need, all because of one borderline result on a scan that might not have changed their actual fracture risk. Another concern is the emotional toll. Many older adults report feeling fragile or afraid to stay active after hearing their bone density has dropped a few points, even if their actual risk remains low. This can lead to reduced mobility, less exercise, and ironically, weaker bones over time. Large-scale studies, including those published in the New England Journal of Medicine, have confirmed that for low-risk seniors, repeating DEXA scans more often than every 2 to 5 years rarely changes treatment decisions. Yet, it significantly increases the likelihood of being labeled with a condition that may never cause harm. Better tip: if your last bone density scan showed strong or only slightly reduced bone health, ask your doctor to space out future scans and focus instead on proven daily habits: eating calcium and magnesium-rich foods, getting enough vitamin D, doing weight-bearing exercises like walking or light strength training, and practicing balance exercises to reduce fall risk. These lifestyle measures can strengthen bones and prevent fractures far more effectively than chasing small, insignificant changes on a yearly scan. Number 2. Annual chest X-rays without symptoms for many seniors. Chest X-rays have become a routine part of yearly checkups, often ordered just to be safe. The logic seems harmless: a quick picture of your lungs and heart to make sure nothing is wrong. But here's the reality. For healthy adults with no symptoms, manual chest X-rays rarely find anything life-threatening that wouldn't have been discovered otherwise. And they can set off a chain reaction of unnecessary, risky, and expensive medical interventions. One of the biggest problems is false positives, shadows, or spots that look suspicious but turn out to be harmless. These could be old scar tissue from a past infection, calcium deposits, or even artifacts. From the way the X-ray was taken, once something unusual is spotted, most doctors feel obligated to investigate further. This can mean repeat X-rays, CT scans with much higher radiation doses, invasive biopsies, and even surgeries. For seniors, these follow-up procedures carry higher risks, including lung collapse, bleeding, infection, or serious complications from anesthesia. And in many cases, the abnormality that triggered all this worry would never have caused illness or shortened life. Radiation exposure is another concern. While a single chest X-ray carries a low dose, having one every year without medical necessity adds up over time and cumulative radiation exposure is linked to a small but real increase in cancer risk. This is especially important for older adults who may already be undergoing other imaging tests for unrelated conditions. In fact, a landmark study in the Annals of Internal Medicine found that routine chest X-rays for people with no symptoms did not reduce deaths from lung cancer or heart disease, but did lead to significant overtesting and overtreatment. Better tip: if you have no chest pain, cough, shortness of breath, or other concerning symptoms, skip the annual chest X-ray. Instead, focus on preventive habits that actually improve lung and heart health: staying physically active, avoiding secondhand smoke, getting recommended vaccinations like flu and pneumonia shots, and managing conditions like high blood pressure or diabetes. Reserve chest imaging for when you and your doctor have a clear reason to suspect a problem. That's when it can truly save lives. Number 1. Carotid artery ultrasound screening without symptoms. Carotid artery ultrasound is a painless imaging test that looks for blockages in the main arteries supplying blood to the brain. It's a powerful tool when someone has symptoms of a transient ischemic attack, mini-stroke, sudden weakness, speech problems, or vision loss. But for healthy seniors with no such warning signs, getting this test as a routine stroke check can be one of the most dangerous forms of overscreening, not because the scan itself is harmful, but because of what often follows. Here's the problem: as we age, it's common to develop mild narrowing in the carotid arteries that never progresses to the point of causing a stroke. Yet when a scan finds even moderate narrowing, many doctors feel pressure to act before it's too late. That often means sending the patient for an invasive procedure such as carotid endarterectomy, surgical removal of plaque, or carotid stenting. Both are major interventions, and in seniors, especially those with other health issues, they carry substantial risks, including heart attack, bleeding, nerve damage, and, ironically, stroke during or immediately after the procedure. A JAMA Neurology Review found that the risk of serious complications from these surgeries in symptom-free patients could actually be higher than their risk of having a stroke if left untreated. The cascade doesn't stop there. Even if surgery isn't performed, a borderline scan result can lead to years of unnecessary medication, frequent follow-up imaging, and the emotional weight of believing you're at high risk, which can cause anxiety, avoidance of physical activity, and reduced quality of life. And because these screenings are often marketed directly to seniors at community health fairs or mobile clinics, they're sometimes performed without a full medical history, leading to one-size-fits-all decisions that ignore individual risk profiles. Better tip: if you have no symptoms of stroke and no strong personal or family history of vascular disease, skip routine carotid ultrasound screening. Instead, focus on proven stroke prevention habits. Keep blood pressure and cholesterol under control. Stay active with daily walking or light exercise. Avoid smoking. Eat a diet rich in fruits, vegetables, and omega-3 fats, and maintain a healthy weight. These steps protect your brain and arteries far more effectively than chasing minor imaging results that may never have mattered. That's our countdown of 7 medical checkups you should skip after 60, not because we're against preventive care, but because real prevention is about choosing the right tests at the right time for the right reasons. Modern medicine can save lives, but over-testing can take a toll on your body, your peace of mind, and your wallet. For seniors, every medical decision should be a balance between the potential benefits and the real-world risks. By avoiding unnecessary screenings, you reduce the chance of false alarms, invasive procedures, and harmful side effects, and you give yourself more time and energy to focus on what truly improves your health. Remember, prevention isn't about doing everything, it's about doing what works best for you. Which of these tests surprised you the most? Have you ever been through a medical procedure you later learned was unnecessary? Share your story in the comments and don't forget to subscribe for more senior health tips that can keep you living well longer.